You finally made it. You are at your first fertility clinic appointment. You go in, you get your labs done, and then you have your follow-up. And one of these numbers that's looming over you that they start talking about is AMH, your anti-mullerian hormone. And they make it sound like you're on your deathbed. Your fertility is gone, you have nothing left, and you have no other choice but IVF. But is that really the truth? Should you put all your eggs in one basket? Pun intended. Let's dive into this topic deeper that I get questions about so often because AMH levels are very commonly drawn. There's a lot of other pieces to include in the puzzle. It's not just one thing you should be looking at to make such a big decision as moving toward IVF. So we're going to dive into all of that today. I can't wait to unpack it for you.
God designed your body for fertility, but when the journey to parenthood feels like a heartbreaking mystery, it's so easy to feel lost. I'm Dr. Trisha, a nurse practitioner and fertility consultant who's been where you are. That's why I created Fertility by Design, where faith meets science to empower you with real solutions, holistic healing, and biblical encouragement. You are not alone. Your fertility is not broken. So let's walk this journey together.
Welcome back to another episode of Fertility by Design. I am so excited to talk about AMH today because we get so many questions, and I once did a guest podcast on this topic as well, and I feel like it has gotten so much attention, and so it's really not a topic that's talked about enough, and there's a lot of misinformation and honestly a lot of scare tactics used surrounding this number in the traditional medical world. We're going to talk about what AMH is, what it's not. We're going to talk about how one of my clients actually increased her AMH levels, which she was told was impossible. And then we're going to dive into 3 things you should be doing if you've been told you have a low AMH level. First thing, what is AMH? AMH, also known as your anti-mullerian hormone, is produced by granulosa cells that are developing on the ovarian follicles. Okay, so your follicles are the developing eggs. The granulosa cells will produce AMH, and this can be a very indirect indicator of the number of eggs left. So unlike FSH, it can be measured about any time in your cycle. So FSH really needs to be looked at day 3, between day 2 and day 5, because day 3 always falls on the weekend. And it can give you a little bit more insight into indirect measurement of how many eggs are left. We look at FSH typically for ovarian reserve, but also if it's just slightly elevated, sometimes that can indicate issues with egg quality. If we're seeing it on the higher spectrum, higher side of the scale, then we're leaning a little bit more towards ovarian reserve or primary ovarian insufficiency. When we're looking at AMH, we can check that anytime in the cycle. Again, it's an indirect measurement of how many follicles you have. So the lower the amount of follicles, then the less likely you are going to be able to stimulate when you do procedures like IVF, because their goal is to get as many follicles as possible and to be able to retrieve those eggs. And so when the AMH is on the lower side, typically that means you will not respond to their treatments as well. A lower AMH, usually less than 1, may suggest that there's a decline in ovarian reserve, but it does not predict your ability to get pregnant naturally, okay? It does not. So that is where I think a lot of this goes wrong, and we assume that because we have a low AMH, we can't get pregnant. It's not true. So what AMH isn't is it's not a definitive measurement of egg quality or that likelihood of conception. It should not be used as a scare tactic to rush into IVF. In some cases, like I was saying, AMH levels can actually improve with proper interventions and healing strategies. So let's dive in a little bit more of what actually can negatively affect AMH and lower it besides a low count. So how can you have a lower AMH, but maybe not actually have a low egg count? Alcohol and smoking are actually 2 of the most studied things to negatively affect AMH and egg quality. Frequent binge drinking has been associated with lower AMH levels in reproductive aged women. Now, if you're just having your occasional drink here and there, don't read this as you can't have that. Okay, we know there's balance. If you've struggled with knowing how much alcohol is too much, go back and listen to our alcohol and fertility episode. We have that link for you in the show notes. But if you are regularly having college-like binges, probably time to step away from that. Active smoking also is another contributing factor to low AMH levels, especially as you get into those later reproductive ages. Those have been linked to a decreased AMH, but passive smoking or former smoking appears actually less impactful in the research. So again, I went to college with some ladies who, when they drank, they smoked. And so if that was you back in the day, don't kick yourself, okay? If it was occasional, not likely to have affected your AMH level at this point. We know nutrition actually plays an important role in AMH levels. A 2024 study found that there were correlations between nutrient intake, body composition, and AMH levels, suggesting, of course, that diet and lifestyle do matter. And we know that here at Fertility by Design because the Lord made us. He gave us the food that we eat in whole food form with all the nutrients that we need. So again, I don't know how we can be medical professionals and telling people that nutrition doesn't matter when it's literally what our body functions off of. So don't let me go down that rabbit hole today, okay? So let's compare AMH with antral follicle count. A antral follicle count is the actual measurement of how many follicles there are on the ovaries around the time of ovulation gearing up. So this is a more direct measurement. It's going to give you a better, accurate count of your actual egg reserve than the AMH. AMH is just showing that hormonal signal of growing follicles, where antral follicle count is the actual count of visible follicles on the ultrasound, and they can measure them. What AMH can kind of predict is ovarian response roughly. There's no timing needed, so it makes it a lot easier to get an AMH level than it does an antral follicle count. But AFC is going to give you a better gauge on IVF response, egg retrieval, and those cycle outcomes for more invasive treatments like IVF. There's limitations, of course, to AMH. We talked about those. It does not reveal quality. It doesn't predict your ability to get pregnant naturally, and it's often influenced by PCOS. So a lot of times these women with PCOS will actually have a very high AMH level, and they'll be confused by that because it falls within the normal range, which is gigantic. And they'll be like, oh, my AMH is actually fantastic. It's amazing, but actually it can be too high. And typically if we see it above 4 or 5, we're starting to think, okay, is this a potential PCOS case? And want to dig a little bit deeper into that. Why? Why does it happen like that? Because when there are lots of follicles, when there are many, many follicles developing on the ovaries, but none of them are maturing, which is commonly seen in PCOS, we can see high levels of AMH despite a well-matured follicle that is going to ovulate and produce a healthy pregnancy. So that's important to note as well. And the AFC is, of course, has a little bit of like whoever is doing the ultrasound, there's some variability, and it still doesn't gauge egg quality. Maybe you have been told that you have low AMH. What should you do next? Well, it makes it really important if you have fewer eggs that the quality of your eggs that you do have left matters. Okay, so low AMH is not your fertility is completely doomed. You have no chance of conceiving. First of all, the Lord can do anything with anything, and you only need one egg and one sperm. But it does raise the stakes when it comes to nurturing what you have left. So there's such an importance in optimizing the health of you and your spouse, reducing oxidative stress that could be lowering egg and sperm quality, and really truly coming in and supporting your reproductive system and diving deeper into what could be potentially affecting your egg quantity and quality. One of my clients and I walked through this where she had low AMH levels, and when we did her functional testing, it came back that she actually had a lot of gut inflammation as well, We worked on healing her gut, reducing inflammation, and optimizing her nutrition. And at one of her next OB appointments, she had had it checked previously. We did all this work. She had it checked again because they wanted to check it again. And her doctor really couldn't believe it that her AMH had actually improved pretty dramatically, even though she'd been told that was impossible, that she couldn't improve it. So this story, really, I'm telling it to highlight that there's so much hope behind that functional root healing. It's proof that one lab is not the end all be all of your fertility journey, and that lab values like your AMH can shift. When you have negative lab values back, even other testing, other hormones, that's not the final say. God has the final say. There's so many healing tools that we can use to optimize our health, to sort our bodies well, and actually heal our hormones. So here we go. Now, 3 empowering steps. If you have low AMH, what you can do. 1, the first thing is going to be change those contributing factors. If you know you're drinking a little bit too much, if you know you're a smoker, if you know that your nutrition has room for improvement, and we know we need to lower inflammation, make those changes. Those small shifts can lead to such huge, huge impacts. I see it all the time. People will think they haven't made that many changes in their life, but it's actually created this large shift, and they start feeling better on the outside and on the inside. Next would be to optimize couples' health. Fertility is a team sport, so we want to optimize on both sides when we know we are struggling to conceive and we have low AMH levels. We want to dig into functional lab testing like gut testing, maybe some micronutrient testing, looking at the hormones, especially inflammatory markers as well, to see if there are any hidden blockages that are negatively impacting that AMH number, as well as the egg and sperm quality. The next and third piece that I want you to know is that you have the right to be able to choose informed and faith-filled next steps. Don't let anyone scare you with your AMH level into invasive treatments. It is a number, and we want to know what it means, but we also want to be empowered and knowledgeable about all the other options and what can affect it. There are other options like optimizing your health through functional medicine first, targeted healing. And from my client's perspective, it can feel so much better to know that you've worked on healing your body and optimizing your health and stewarding your body well prior to making any decision to even walk into more invasive treatments like IVF. Because here's the thing, when our AMH is low, it can really be a sign that there's more going on under the surface. And if we don't address what's going on under the surface, then it makes those treatments less likely to be successful anyway. So it makes sense to optimize our health first. We always want your decisions to be empowered, not urgent, not made out of a scarcity mindset, but out of an abundance mindset, because we have abundant faith in the Lord and what He can do. Any decision that's made out of fear or feels like a fear-triggered decision is not from God. So remember that. When you're walking into these decisions, you want to feel peace. So take the time, pray over them. Don't let anybody scare you. You may come to the conclusion that those next steps into IVF are the right decision for you. That's between you and God, but you don't want it to be just between you and your provider. It's really important to walk into those big decisions feeling empowered, not like you're being forced at gunpoint to do these next step things. Hopefully you realize today that AMH is a helpful marker, but it is really only one piece of your fertility puzzle. Your value and your hope and your fertility outcomes are not determined by just a number. So lean into prayer, not panic. Let your next steps be grounded in peace, stewardship of your body, and partnership with God. I hope this episode blessed you so much. If it did, share it with a friend. If you are looking for support that blends this functional insight, communities, and spiritual guidance, come join our Faith and Fertility Circle, where you're never alone on the journey. We are so glad you came here today, and we will see you next week.
That's it for today's episode of Fertility by Design. Subscribe so you never miss an episode, leave a review to help more couples find hope, and share this with a friend who needs encouragement on their fertility journey. Need even more support? let's connect. Find me on Instagram at Trisha Zehrung for faith-filled fertility guidance, real solutions, and a community that just understands. Remember, your fertility is not broken. Your body is beautifully and wonderfully designed, and God's plan is always perfect. I'll see you next time.